I think that every country is different. Certainly as an American, but having lived outside of America for a number of years, I can tell you firsthand that the way that different countries perceive different parts of the healthcare sector is very different, and it varies significantly.
I think it's super interesting. It's the sort of the politicization of it that is so shocking and actually very dismaying to a lot of us Americans. So it's not so much that people did mistrust healthcare or professionals, but it has now become so politicized that now they do. So it's not because of COVID, but it's the politicization of the issue in my country that has really made it really challenging for healthcare professionals. You only have to look to see what has happened in the CDC and with Dr. Fauci and even the NIH. It's shocking, but it's amazing how quickly that can happen. So I would really love to hear how in Japan, where you don't have the politicization necessarily that we have here, how that changed the perception of healthcare providers in COVID times.
I don't see the politicization in Japan, maybe perhaps because the death toll and, the casualties is not so much from where I'm seeing. But what's changed is, there's so much more people focusing on the healthcare sector. And, that's not just, just the healthcare, which was enclosed just within the healthcare industry. Now even normal people like me is focused on healthcare, the healthcare industry, and what's going to happen over the next 10 years. And so as more people are focused on it, then the gaps in the systems, what could be improved, is also being focused on. And that's why there are much more people in the startup industry as well, trying to focus on fixing some problems. So I think that's one of the positive issues that's going on.
Yeah, it actually has changed the way the people in Japan sees the medical industry. Yes, there are some criticisms against healthcare providers, but there are more and more respects toward the healthcare providers, in my opinion. This is a change that is showing that healthcare is an everyday issue. It's not an issue that occurs once in a year or once in 10 years, but it's an everyday concern. It's a healthy concern. It's a good concern to have. And yeah, we should make the most use of this change to develop medicine even more.
My hope is that out of this pandemic, there will be a renewed realization and understanding and effort that we, as Dr. Okiyama said, this is a societal thing, right? We cannot tackle a pandemic country by country, state by state. And my hope is that from this, there will be a renewed realization that we are all one planet. And for us to defeat viruses like this, and for us to really improve human health through technologies like genomics, that we can't do it individually. We can't do it country by country, and we have to do it as a society.
GLOBIS.